Hey guys, so we're looking at diabetic emergencies today. And this is a PowerPoint I put together so that you can have a basic understanding of this disease and how to manage it in an emergency. Because a lot of these times we actually know what the disease is, but there are some complications that can happen that can turn into emergency if you're not aware of what you're looking at, right? So what is diabetes? Our body requires energy to function. First thing, if we don't have food, we can't function. Basic things such as breathing, moving, sleeping, that is energy that we are spending and we need that, right? To be able to do what we have to do. We get this energy from glucose, and glucose comes from the foods we eat. Glucose needs to be broken down into more simple sugars to get into our cells. We need insulin to break down these glucose that is secreted from an organ called the pancreas. So the problem with diabetes, or somebody can become diabetic or pre-diabetic, is because the insulin release is not enough to break down and handle the amount of sugar that we are consuming or glucose that we are consuming. This is what is known as diabetes. How can I know if my blood sugar is elevated? If you're suspecting that you have high blood sugar, and I'll talk to you about the signs and symptoms coming up later on in this presentation, you will be able to go to a drugstore. You can buy a small instrument called a glucometer, and you'll see the glucometer on the page here with the digital reading. A normal blood sugar reading will be 90 to 100 milligrams per deciliter, and we're looking at 70 is going to be a little low. You want to make sure that you don't have your blood sugar too low as well. Now, if you have been diagnosed with diabetes, one of the things that you would be doing is checking your blood sugar regularly to make sure that you are not too high or low. I've actually worked with a colleague in the past where her blood sugar was 40, and she just found that out because we were just playing around and we wanted to test each other to see what our blood sugar was. And this was like during the day. This was like 2 o'clock in the day. It wasn't like she just got up and did not eat anything from the night before. And she exhibited no symptoms. She was not tired. She did not feel starved or anything like that. So I would always say we have the figures and the ranges to work with, but if you're not exhibiting symptoms or you haven't been diagnosed with this disease, be mindful that it's not critical where your blood sugar is going to drop and you might be having X or Y happen to you. Everybody is different. That's why it's so important that you need to get yourself to a doctor, diagnosed, and a proper check being done so you know what's happening to you, especially in your blood. If you are unsure, a good thing to do is check and see what your blood sugar level is after about 2 hours after you've had a meal. Anything above 200 milligrams per deciliter, you're looking at that being a little high and of some concern. It also depends on what you eat, but I would say 2 hours after, not supposed to be that high. So there are two types of classification when it comes to diabetes. Type 1, which was formerly known as juvenile or insulin-dependent diabetes. It's usually found in childhood, but it can sometimes be present in adulthood as well. The pancreas at this point does not produce any insulin, and therefore insulin must be taken as an external medication. You can get insulin in the pharmacy, but it must be prescribed because the amount that you have to take must be prescribed by a doctor who has assessed you and done all the tests that is necessary, and they will know how much you need to manage your diabetes. Type 2 is known as non-insulin diabetes, dependent diabetes, and usually you find this in adults. Adult onset type diabetes is what type 2 will be called. The choice of lifestyle and your family history are going to be some risk factors pretty high for getting this type of disease. Obesity, sedentary lifestyles, and high sugary diets are often high risk factors for getting this disease. It can be controlled by a healthy diet. You take off, you lose some weight, and you continue with exercise. Insulin may be required as other medication, especially if it's really high and you need to get it down in a manageable place. Now, the thing is, this is a lifestyle disease, and if you have not heard that before, it can be managed through certain changes that you make regarding what you do. So what you eat is going to be making a difference. How much exercise you are involved with in a week or so, and you know what your basic lifestyle consists of. So all those things are going to be playing a huge role in managing your diabetes. But wait, is there really one more? There is. There is one more, and we don't really hear much about it. Let me tell you what that is. It's gestational diabetes. And gestational diabetes occurs in some pregnancies. This type usually disappears after the baby is born, and the babies that are born, they're usually a little bigger than a normal sized baby, and because they were born with gestational diabetes, they too can be prone or at risk for having diabetes later on. Insulin resistance occurs during pregnancy due to different hormones that are produced during that time. So women who had the gestational diabetes are also at risk for having type 2 diabetes in their older years as well. So some women may require insulin until the birth of the baby, but usually you find that after that baby is born, things just kind of go back to normal. So this is one that's not talked about much, I would definitely say, because everybody just talks about type 1, type 2. So let's look at low blood sugar, hypoglycemia. And when we talk about low, think hypoglycemia. Always the O, hypo for low blood sugar. Hypoglycemia is the term used to describe low blood sugar, and it's also referred to as an insulin reaction. There's either too much insulin or too little or delayed food intake. Now, when we're talking about hypoglycemia, we're talking about somebody who has diabetes. From here on in, you're going to be talking about somebody diagnosed with diabetes, has it. This is what happens to them, especially if they're on insulin. Either too much insulin or too little food or delayed food intake. So for instance, if I am diabetic, I have high blood sugar levels, I need to take insulin. But if I don't eat enough food and I take insulin, the insulin is going to break down that food too much, and then it will not be able to feed me. So my blood sugar level will be so low, I'm going to start experiencing certain things. The American Diabetes Association regards the symptoms of hypoglycemia as this: pale color face, sudden hunger, excessive sweating, trembling, seizures. Those are just to name a few. So if you know somebody who has diabetes and they're experiencing these symptoms, know that that might be a sign of low blood sugar, hypoglycemia. How do we manage that person, that hypoglycemic person, that diabetic who is now low blood sugar? These persons are definitely in a sugar deficit. As I said before, if you took your insulin and you did not eat, you're going to be in a sugar deficit. They will exhibit sudden symptoms very suddenly, very suddenly. If in doubt, give sugar or a sugary drink once they are responsive. If they are not responsive, do not give anything by mouth. If they are unresponsive and you put liquid in their mouth, they are likely to aspirate because they have lost the ability to manage their airway or to swallow. If somebody is unconscious or unresponsive, that is no longer something that they can manage. So don't give them anything by mouth if they are unresponsive. Seek medical care at this point, and if the victim becomes unresponsive, this condition is known as insulin shock, and that is just what I described earlier on. The brain and other vital organs, they need to function. They need to be fed. And if that blood sugar reaches the point where it's not happening or very minimal, the person may shut down and go into what we call different multiple organ distress syndrome, or a number of other things. Don't want to get too much into that. This condition is life-threatening, and you want to seek medical care immediately with this person. So hyperglycemia, just now is HYPO, this is HYPER. That is high blood sugar, this is the definition, and what you would see with diabetic patients. Now the thing is, this condition happens when too much glucose is in the blood and the insulin is not doing its job, or there's not enough insulin to be able to do the job, I should say. This can be caused by insufficient insulin intake, overeating, inactivity, illness, stress, or a combination of these things, right? And it goes back to what we talk about, the lifestyle that you have, how it can allow you to, you know, be at risk for getting hyperglycemia or diabetes. The American Diabetes Association lists these as signs and symptoms. You're looking at extreme thirst, flushed skin, frequent urination, heavy breathing, fruity breath odor, and vomiting. I've seen persons in my career with blood glucose levels of 600. I think 600 was the worst I've seen, but I've heard of people having blood sugar levels much higher than that, and that is a whole different ball game we're talking about. They are now going into a different category of from one to the next point. Diabetic ketoacidosis, HHNC, all those different things can happen, which is as I said, a whole different ball game when that happens to that person. All right. So how are we going to manage a hyperglycemic patient? If you're uncertain the victim has hyperglycemia or hypoglycemia, give them that sugary drink and wait a few minutes for improvement. The thing is, if they have low blood sugar and you give them that sugary drink, it's going to help them to improve. If they have high blood sugar and you give them that sugary drink, it's not going to really do much difference then, because they already have high blood sugar, and you would know that this person is not hypoglycemic. This person is probably very dehydrated, very thirsty, and they probably have been experiencing this a few days and just getting worse. If no improvement, you want to seek medical care. If the victim is a known diabetic, you want to ask he or she if they took their insulin for today or the day. Understand that their signs and symptoms will take place gradually if they have high blood sugar levels. Remember, we talk about the hyperglycemia is a gradual onset. Hypoglycemia, it's kind of fast, sudden. This condition can lead to a diabetic coma. Are we talking about a hyperglycemic patient? And I was telling you about the ketoacidosis and all of those good stuff. So in summary, as we close off, diabetic emergencies can be classified as either hyperglycemia or hypoglycemia. The blood sugar levels are either too low or too high, right? And we spoke about how we can know the difference between those two. Remember, if in doubt, give that sugary drink. If responsive, and if you can wait about 15 minutes, that will be good, so you can see if that person is improving, if they're getting less anxious, they're not cold sweating, they don't feel dizzy or tired. That would help you know that the sugar is helping. If they are not, you need to seek medical attention. And I would think that if you, for the first time, realize you gave somebody a sugary drink, it's always good for them to go see a doctor afterwards as well. Don't just leave it like that. This disease can be managed through choices we make in our daily existence. And that's a wrap. So as I always say, if there are any questions, because this is now going to be on our channel, please guys, if you have any questions with this, leave me comments below, and you can also visit our website at www.lifecycle360tt.com. Check us out on Instagram and Facebook. I'm going to leave the links there for that, and I would love to hear from you. So with that, I say adieu, and thank you for staying tuned for Friday Fragments. I'm not going to tell you what's up next week, so stay tuned. It's going to be more good stuff. Okay, guys, thank you for listening in. Take care. Bye-bye.